So if we look at the various dysglycemic categories, we have type 1 diabetes, where there's no insulin or insufficient insulin produced. Type 2, we have insulin resistance. We're going to talk about all these. Prediabetes, where glucose is higher than normal, but below the diagnosis of diabetes. And by the way, I don't tend to use this term prediabetes. I call it early diabetes, early onset diabetes. Gestational diabetes, we have blood sugar disorder developing during pregnancy. Okay. We also have metabolic syndrome, where they have multiple risk factors. We're going to talk about that. That are specific for cardiovascular disease. Now, we also have one called diabetes type 3, which is a fairly new category. And this has now become another name for Alzheimer's disease. You know, people die of Alzheimer's disease. When I first got into healthcare back in 1976, Alzheimer's disease was virtually an unknown. And what we're now finding out is that blood glucose has a lot to do with the development of Alzheimer's disease. Long-term glucose imbalance can lead to type 3 diabetes, as well as type 1 or 2. But look at this portion right here. Elevated blood glucose levels disrupt connections linking brain regions, causing restricted blood flow and glucose availability. Brain shrinkage, which results from restricted blood glucose availability, results in cognitive difficulties, which we refer to as Alzheimer's disease, okay, or type 3 diabetes. The term type 3 diabetes has been proposed for Alzheimer's disease because of shared cellular features among type 1 and type 2 diabetes and insulin resistance associated with memory deficit and cognitive decline in elderly individuals. What's the youngest any of you have ever seen with somebody who's been diagnosed with Alzheimer's disease? I saw somebody that was diagnosed at age 19. That's very, very young and certainly not common, but we're seeing younger and younger people that are now associated with having Alzheimer's disease. Okay. So it's increasing, and it is associated with an elevated blood sugar level. And the rise in Alzheimer's disease, if you look at this graphically, and the rise in diabetes, they're both going up together. If it's not a causal relationship, as sure as heck there is an association. Primary mechanism driving both is a diet that's associated with high blood sugar or hyperglycemia. Okay, projected number of people age 65 or older with Alzheimer's disease, and it is climbing very, very rapidly. I was trying to find one that showed that chart which showed it under age 65, but it hasn't been looked at real carefully yet. But the older people get, the more the more we see of it. But we see people, considerably number of people now, between the ages of 50 and 65, they're developing this as well. Okay, so what this actually comes from, in many cases, and there's probably other reasons people develop Alzheimer's disease too. I mean, one of the things that we recognized epidemiologically probably 30, 40 years ago was the association with aluminum and other heavy metals associated with Alzheimer's. So it's not like it's a unifactor, just one cause of this. It's probably multifactorial. But one of the things that seems pretty prevalent is where people have a lack of glucose reaching their brain. And as a result, they get brain shrinkage. And that's the hegemonic of Alzheimer's disease, that you actually have shrinkage of the brain tissue. Okay. These are some brain scans of people with Alzheimer's disease, and it shows these amyloid plaques that are occurring. So you get this plaquing within the brain, and you also get a shrinking of the tissues.